I'm Dr. Lora Shahine. Welcome to my YouTube channel. Today's video is titled, Am I Having a Miscarriage? All about first trimester bleeding. I'm Dr. Lora Shahine. I am a reproductive endocrinologist and miscarriage specialist, helping people build families for over 15 years. And when you are trying to build your family, you are finally pregnant, if you have any spotting, any bleeding, any cramping, sometimes the first thing that comes to your mind is this must be a miscarriage. Something must be wrong. After you finish this video, I want you to have some reassurance of how common first trimester bleeding is, understand the different causes of first trimester bleeding, and learn how to figure out, with the help of your doctor and your healthcare providers, what exactly is happening and causing that bleeding to help you understand. Like this video if you learned something, comment with questions that you have, and subscribe to this channel so you can always know what's coming next. I am here to help you learn everything that you should know about your reproductive health, one video at a time. First trimester bleeding is so much more common than we realize. It happens at least 25% of all pregnancies. But if you are so excited to be pregnant, if you see anything or feel anything that might be off, sometimes the first thing that comes to your mind is this must be a miscarriage, especially if you've had a miscarriage before. So pregnancy after a miscarriage can just be like walking on pins and needles, just waiting for the other shoe to drop or waiting for bad news. And so anything that seems a little bit off can just be so worrisome. So I want you to understand a little bit about first trimester, the body's changes and development, and why bleeding can be so common. So the uterus is one of the most vascular organs in our body. It is incredible how much it can change in pregnancy, especially early pregnancy. And there's so much vascular change between the pregnancy that is implanting within the uterine wall. So blood vessels are created, blood vessels enlarge. There's a lot of blood flow throughout the pregnancy and throughout the uterus. So it's actually surprising that we don't see more bleeding in first trimester, but when we do, it does not necessarily mean that there's something wrong. And I want you to understand a little bit more. When my patients ask me about first trimester bleeding and they want to know, am I having a miscarriage? I think about causes of first trimester bleeding. And there's about 5 categories. Number 1, I think about implantation bleeding. This is a pretty vague term. It's not really well defined in medicine or pregnancy information. When I think about implantation bleeding, I think about how much change happens in that uterus, especially in the first trimester. So blood vessels are changing, cells from the fetus and the placental cells are invading into the uterine wall. And when that happens, blood vessels get bigger, increased blood flow comes to the uterus. And if there's a little bit of bleeding, and when we do the checkup, everything seems nice and normal, I think, okay, this can just be implantation bleeding. This can just be sort of the normal changes in pregnancy. And I try to reassure my patients. Number 2, when I'm thinking about bleeding in the first trimester, I think about cervical bleeding. And so the cervix is the end of the uterus. It's what opens to allow the delivery of the pregnancy. It's what we see when we do a speculum exam. We kind of see the cervix. It's what we pass, catheters through when we're doing an intrauterine insemination or an embryo transfer. The cervix is kind of right there. And as the pregnancy develops and increased blood flow and hormone changes happen in the cervix, it can get pretty sensitive. And so it can have a tendency to have bleeding. Things that could cause the cervix to bleed are intercourse or a transvaginal ultrasound. So things kind of touching the cervix when it's really sensitive can cause bleeding. Now, intercourse and a transvaginal ultrasound will not cause a miscarriage, but just saying that the touching of the cervix, if it's really sensitive, could cause spotting. And so that's something to think about and talk to your doctor about as far as when the spotting happened and sort of timing. Other things are, sometimes people get a pap smear in early pregnancy. That's a way to screen for cervical cancer. If you've had a pap smear and afterwards you're having a little bit of spotting or bleeding, it's most likely coming from the cervix. And last, there could be some infections in the cervical cells that can cause bleeding. So I think about those things. Number 3, as far as bleeding in the first trimester, I think about a subchorionic hematoma. A hematoma is a bruise or a collection of blood cells, and a subchorionic hematoma is a collection of blood or a bruise in between the chorion, which are sort of the placental cells and the fetal part of the pregnancy, and the uterine lining or the uterine part of the pregnancy. So as this incredible communication and connection and body changes are happening, there's a lot of exchange of blood flow and changes. And if there is bleeding from a vessel and that bleeding is pretty heavy and collects into a pocket or a hematoma, you can see that on ultrasound. And if some of that blood comes out of the body, that will be bleeding that the patient can see and be worried about. So sometimes it's found incidentally. Sometimes I see it on ultrasound and I'll talk to my patients about it. Or sometimes people will have bleeding, we don't find any other cause, and then we see the subchorionic hematoma on the ultrasound. So if I see this with my patients, I talk about pelvic rest. Talk to your doctor about what's right for you. Pelvic rest means nothing in the vagina, so no intercourse, lots of rest, hydration, things like that. I want to be really clear that intercourse does not cause a miscarriage, and activity levels do not cause a miscarriage. But when you have a bruise or a collection of blood that is needing to be reabsorbed and kind of resolve, the more active you are, the more it might disrupt that process of reabsorption, and you might see a little bit more bleeding. So it's just going to increase your anxiety. And so we just talk about taking it easy and a little bit of pelvic rest until we can watch things a little bit further. The last two things that I think about with first trimester bleeding are abnormal pregnancy issues. So ectopic pregnancy is kind of number 4 in my differential, and then molar pregnancy is number 5. Ectopic pregnancy is a pregnancy that implants outside of the uterine cavity. Ectopic, outside. So most of the time it implants in the fallopian tube, but it can be on the ovary and it can be in other parts of the pelvis. But an ectopic pregnancy is not a normal pregnancy. It's not going to continue to develop. It can sometimes show up as cramping and bleeding. And so that is something that I'm thinking about until I can confirm that the pregnancy is inside of the uterus. I think about an ectopic pregnancy. And the final thing is a molar pregnancy. It's a very rare pregnancy complication. It's an abnormal pregnancy as well. It's an overgrowth of placental cells. It will not be a healthy baby, and it's something that needs to be followed very, very closely. And we can figure that out with ultrasound and some blood tests too. First trimester bleeding, there can be so many different causes. It could be implantation bleeding or just a normal part of that particular pregnancy development, all the way to abnormal things that need to be really taken care of. So it's important to review with your doctor if you are having bleeding or spotting in pregnancy, so that you and your healthcare team can figure out the right path for you. So in early pregnancy, how do you figure out what's going on? Well, sometimes it takes some time, but blood tests and ultrasounds can really help us figure out why someone's having bleeding. A pregnancy makes a hormone called beta HCG. This is the pregnancy hormone. You can do a blood test, and as the pregnancy is developing, the hormone levels go up. In early pregnancy, it can be pretty predictable. So very often we'll get a pregnancy test about 10 days after an embryo transfer, and then we'll check 2 days later, because typically a healthy pregnancy will double or even go up by 60% in about 48 hours, kind of that quantitative number of HCG. So that can be reassuring. Now, there are normal pregnancies that don't follow that perfect graph, but it is very reassuring to see the numbers going up, and we follow it pretty closely in our fertility patients. Transvaginal ultrasound can see a pregnancy really early, and so that can be a way to figure out why someone's having bleeding. Even at about 6.5 weeks of pregnancy, even though the pregnancy is about the size of a grain of rice, we can often see a gestational sac, fetal pole, even a little bit of cardiac activity or flicker at about 6.5 weeks. So those are the things that we're looking for to get reassurance from the pregnancy when someone's having bleeding or cramping. But before about 6-ish weeks, everything could be fine, but we really might not see anything on ultrasound. So patients often call and say, hey, I know I'm pregnant. I've had a positive pregnancy test. I haven't had my ultrasound yet because it's so early. Tell me what's going on. And this can be so frustrating because I want to have a crystal ball and tell my patients exactly what's happening. But sometimes it just takes maybe following the blood tests, because that can be followed really, really early. Sometimes it's early ultrasounds. Sometimes we don't see everything that we want to. And sometimes we just have to repeat that ultrasound or repeat the blood test. And really, honestly, time will tell what is happening. So this is why it's so important to be under good medical care and having a team that can answer your questions. The vast majority of the time, spotting and bleeding in pregnancy is not a miscarriage or something, wrong, but you want to figure that out. A great resource if you have had miscarriages or you're curious about early pregnancy is my book, Not Broken, An Approachable Guide to Miscarriage and Recurrent Pregnancy Loss. I wrote this book to help people advocate for their care, and I hope it could be a great resource for you. You can find it at Amazon in paperback or Kindle form. I have a lot of other information here on YouTube, on Instagram, on my website, my blogs, lots of resources for you. I'm here to help. I hope you learned something from this video. Like this video if you learned something, comment with questions that you have, subscribe to this channel, and stick around for more learning.